Hepatitis is a silent killer that causes over 1.5 million deaths every year. Right now, there are over 300 million people across the world living with some form of viral hepatitis. Now, found at the right time, it can be easily cured, and in most cases, it can be prevented as well. To tell us more about how we can go about doing so, we have Dr. Khalil, the head of the Department of Gastroenterology at Aman Hospital Qatar, with us today. And he will be taking us through some of the most frequently asked questions related to hepatitis.
Hepatitis can be defined as an inflammation of the liver cells. We have many types of hepatitis and many etiologies. One of the etiology are the viral hepatitis. We have viral hepatitis A, the most common, viral hepatitis B and C, and the less common, the D and the E. There's another type of hepatitis, autoimmune hepatitis, when there is a conflict between the immunity system and the host or the body. And we have like drug-induced hepatitis and alcohol-induced hepatitis. For the types of hepatitis, we have the acute hepatitis when the inflammation is new and acute, and if not treated, some hepatitis will be complicated to chronic hepatitis. The chronic hepatitis are mainly hepatitis B, hepatitis C, drug-induced, and alcoholic hepatitis. When we talk about chronic hepatitis, that leads to the major complications, that is the liver failure or liver cirrhosis and complications. Transmissions of hepatitis again depends on the etiology and the cause. For example, for the hepatitis A, the transmission is orofecal. It depends on the hygiene of the food and the beverages. For the hepatitis B and C, it's either due to blood transfusion problem or sexual transmissions. For the hepatitis due to alcohol and drugs, it depends on the consumption of drugs, toxic for the liver, and the consumption, long-term consumption of alcohol. So as medical team, we can diagnose hepatitis by doing the blood test, a simple blood test and serology. So I'm encourage all patients or people to do a routine lab test every year with the liver enzymes and the serology of hepatitis. This is very important. Prevention measures. We insist on the hands hygiene and the use of clean water and foods for hepatitis A, the use of disposable instruments and medical supplies for the hepatitis B, and it's very important to mention the vaccine against the hepatitis B. It can prevent 99% of cases. And there is a good news for hepatitis C patients. There is a new drugs and treatment. It's a very simple treatment. It's an oral pill, and it's very effective. It covers more than 95% of cases. So my final advices are a good hygiene, do the vaccine for the hepatitis B, and do a general checkup and lab test to screen and to prevent all complications due to hepatitis.
So, follow Dr. Khalil's advice, get yourself and your family checked regularly, and do recommend this video to your friends. Remember, prevention is always better than a cure. And if you'd like more information or get yourself tested, simply visit Aman Hospital located at Alpha Mama or get to any hospital closest to you. We wish you and the people you care about a very healthy and a hepatitis-free life.